بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما آمين يا رب العالمين. My topic today is about liver segmental anatomy on CT scan, how to localize it in a simple way. Liver anatomy can be divided into two aspects, either morphological anatomy and functional anatomy. The morphological anatomy did not give the hepatobiliary surgeon the internal feature of the blood vessels, hepatic artery, hepatic veins, and portal system, and biliary duct branches. And the functional anatomy, it is done by Conrad, 1957, in divided the liver into 8 segments, and each segment is functionally independent from other segment, and it is inflow, outflow, and biliary drainage. The portal branch, it is in the center of the segment. Also, the bile duct, it is in the center of the segment, and the hepatic vein, it is at the periphery of the segment. We divide the liver into two slices about the level of the hepatic, at the level of the portal vein, one above and one below, and we will see this in the following slices. The right hepatic vein, this is the IVC, and this is the right hepatic vein. The right hepatic vein divide the right lobe into anterior, this is the anterior, and the posterior segment. Anterior segment include 8, segment 8, segment 5, and the posterior segment include segment 7 and segment 6. The middle hepatic vein divide the left lobe, which include the lateral segment and the medial segment and the right lobe of the liver. This is at the level of the gallbladder, and the left hepatic vein, which divide the left lobe into lateral segment and medial segment. The lateral segment contains segment 2, 3, and the medial segment contain 4A, 4B. Portal vein divide the liver into two parts. The upper parts, it is contain segment 2, segment 4, segment 8, and segment 7. The lower part would contain segment 3, 4B, 5, and 6. So you see as the numbering of the segment in the above part of above part to the portal vein, 2, 4, 8 plus 1, and this is 7, and segment 1 we cannot see it because it is posterior. Segment and the lower part we have 3, 4, 5, 6. It is a clockwise numbering of the segments. We use for localization of the liver segments for cuts. Liver slice A, it is above the portal system, and you see the liver, it is above, it is the IVC, it is embedded in the liver, and slice B, it is at the level of the left portal vein, slice C at the level of the right portal vein, and the slice D, it is at the level of the splenic vein. Here the slice number 1 at the IVC, it is embedded in the liver. You see the left hepatic vein divide. This is the lateral segment, segment 2, and this is segment 4A, and this is the right hepatic vein. This is segment 8 and segment 7 posteriorly. At the level of the left portal vein, the left portal vein is slightly higher than the right portal vein, and which is not seen in this image, and this still the IVC, it is embedded in the liver. You have segment 2 or segment 2, 3, or here this is the segment 4A before B, and this is, you see here, this is the middle hepatic vein, and this is the right hepatic vein, and this is the segment 8 anteriorly and segment 7 posteriorly. At the level of the right portal vein, here you see the left hepatic vein at the periphery of the segment, and this is segment 3 from the lateral segment, and segment 4B from the medial segment, and this is the middle hepatic vein, and this is the right hepatic vein. With here you see segment 5, segment 8, and on this slide also you see segment 6, segment 7 from the right lobe. These are the posterior segment and these are the anterior segment. At the level of the splenic vein, this is here, this is the splenic vein. Here you see segment 3, and this is the hepatic vein here, left side, and this is medial segment 4B from the medial segment, and this is the middle hepatic vein here, and this is the gallbladder fossa here, and this is the right hepatic vein, and this is the anterior segment, segment 5, and this is the posterior segment, it is segment 6. Thank you very much. I hoping it will you benefit from this presentation.